if someone is quite logical or a thinker, and they're eliciting an unconscious signal for a healing frame, okay? And I call the healer within a healing frame because quite obviously what you're doing is setting up a frame for healing. Step one, elicit the signal that you've got, and you could utilise the pain if it is there as a signal. Step two, from there, ask your unconscious mind, does it know how to heal X condition? Now if you've got pain and you're not sure what the condition is, you're looking at healing the underlying condition that the symptom, which is the pain here, represents. Okay? Bear in mind, you're not healing the pain, because if you're healing the pain alone, you're healing the messenger. What you want to do is heal what's underneath it. You're healing the condition that's underneath it. You don't want to take away the messenger. Okay? It's like, imagine there was a fire without smoke. Yeah? Smoke is the messenger. Fire is the thing you've got to put smoke in the fire. But smoke lets you know that the fire is there. So, can it heal it? Yes, or does the unconscious know how to heal it? This condition. From there, can it heal it within a set period of time? Pick what medical wisdom says, what you think medical wisdom says is all divided by 3. You can always, it's a negotiation. If you get a no, let's say it's 8 days, you get a no signal, just increase the time frame. If you get a yes signal, can heal it in 8 days from the unconscious, reduce the time frame, write down. Now, just because it can heal it within this period of time, you then put in, okay, unconscious, are you willing to take responsibility? And the metaphor or the analogy I gave earlier, the unconscious, let's say you've got someone who's diabetic, the unconscious says, yes, I do know how to correct the insulin levels in your body. You might get a no, can the unconscious take responsibility? Because the unconscious will say, well, actually, I want you to moderate. There's something you consciously have to do, and that is moderate your sugar intake, so that in turn the unconscious can easily moderate the insulin levels, just in case that person may be taking way too much sugar in their body. And then lastly, start now. Just a pattern. Now if someone's a thinker, like Bernie's just proposed, and they're thinking, which part of their mind is pushing the signal or creating the signal? And this is where the test of the signal is vital. So for example, if you looked at the signal Mishka had yesterday, that signal is totally involuntary. There's an involuntary response. So, like when you twitch your body, it's an involuntary response. And it's different. Everybody can go like this. Yeah? But if you twitch your body, it's an unconscious response. Does this make sense? Now in hypnosis, quite often, as in the analogy of the story I told you yesterday, true story, about the woman with cancer, the unconscious moves a finger. It's called an idiomotor signal. In NLP, we want to bring that inside for generic signals. So the person, if they want to test anything out or ask their unconscious anything, they don't have to put themselves in a trance to do this. Yesterday I demonstrated to you the postural sway. Now when I had Andy up here yesterday to demonstrate the postural sway, the key thing about that was it was an involuntary sway. Now he could go like this, but it was a purely unconscious response. So the key thing is what you want to test here, you want to test all signals, or 2 signals, a yes and a no. Yeah? And you test them to be involuntary. So, once you've got them as involuntary, you know they're from the unconscious. Now, quite frequently, with the healer within has pain there as a part of the system or part of the thing you're working with. So, for example, there's a condition in the body and there's pain. Now, pain is an involuntary signal, but it's not currently being used as a signal. I say pain isn't yet the signal, pain is the messenger. To turn it into a signal, it needs to go up and down, involuntarily. Not that you can turn your pain up and down through using the hypnotic technique. You say to the unconscious, you say to the client, ask your unconscious to manoeuvre that pain, one way or another, up or down, for a yes signal. Quite frequently increases in intensity for a yes. So you're asking the sensations to increase or reduce for a yes. And then it will go the other way for a no. Now the key is it's involuntary. Because if they can, like, a lot of people can manage their pain. If they can make it happen, it's not involuntary burning, the person's thought their way through. If it is involuntary, you've now got the messenger from the unconscious, which is the pain, and you've now turned that into a signal, because it can say yes and it can say no. Without a yes or a no, it's not, without a no anyway, you won't be able to do the healer within. Now you can do the healer within without a no signal. You could do any NLP, 6-step reframe, with just a yes in. Let's say, does the unconscious know how to heal the underlying condition? Okay, and let's say you don't get a yes, but you've only managed to elicit a yes. It sometimes happens. When you do the elicitation, the clients can give you a strong yes, they can't give you a no. Or the unconscious doesn't give a no. So you say to the unconscious, do you know how to heal the underlying condition? And you don't get any response. So then you say to the unconscious, is the absence of a yes response a no signal? Okay? So is the absence of the yes a no? And then you've now got something to work with. It's just because now you've got a no signal, you can now work with that no signal. The unconscious is saying that it does not know how to heal the condition because you elicited the no through not having a yes. Everybody clear about that? You've got a no through not having a yes. You now ask the next question. Does the unconscious know how to organise your resources so that it can heal the underlying condition? In essence, you're saying, does the unconscious know how to learn? That's the presupposition, it's going to learn how to do it. But it's a bit more precise if you say organise your resources. Because what the unconscious is saying at the moment, it doesn't know how to heal it. If it doesn't know how to heal it, it hasn't got all resources organised. There's a presupposition there. Again, if it knows how to organise it, it can heal. So then you do the whole healer within on organising resources. The next question will be, can it organise your resources by X, Y, Z time, say a week's time? Okay? Yeah, so you get the yes in. Then, okay, is it with a set responsibility for organising resources by X amount of time and start now? So you've done the whole process on learning how to heal or organising resources. So in a week's time, or whatever the specified time is, the client comes back to you, or you meet them on Skype, or however you're working, depending on the location that you're working in, and then you do the healer within. First question is, has your unconscious organise your resources to heal X condition? Again, now you've set the frame. Brilliant. You've got the resources organised. Now you do the pattern.